Welcome to Lesson 2, Benefits, Part 2. Do you remember what the word benefit means? I'll give you a hint. A benefit is something that is good for you. You might remember this from Lesson 1. Number 2 and 3 most accurately reflect what we are talking about in this lesson, especially number 3, which states that a benefit is financial help in time of sickness, old age, or unemployment, a payment or service provided for under an annuity, pension plan, or insurance policy, or a service as in health insurance, or a right as to take vacation time provided by an employer in addition to wages or salary. Our lesson objectives today are a continuation of the ones we did in Lesson 1. What benefits are available to you after graduation, upon age 21, or upon your 18th birthday? By the end of the lesson, you should be able to identify and compare organizations that are available to you and identify benefits that you qualify for and can apply for now or in the future. And of course, our standards have remained the same. Today, I will go over the last 5 vocabulary words, the ones you see in red here, as well as the other benefits we talked about in Lesson 1. First, let's do a warm-up. Do you remember which vocabulary word goes with which definition? The first word is benefits. Are benefits a federal state program designed to provide comprehensive and quality medical care for low-income families? Or a payment or service provided by employers or federal, state, and local governments in time of sickness, old age, unemployment, or disability? Or maybe benefits pays you benefits to you and certain members of your family if you are insured, meaning that you worked long enough and paid Social Security taxes. If you said benefits are a payment or service provided by employers or federal, state, and local governments in time of sickness, old age, unemployment, or disability, you are correct. How about Social Security disability insurance? If you look at the 2 choices, only one could be right. And that is the one that actually says Social Security in it. Social Security disability insurance pays benefits to you and certain members of your family if you are insured, meaning that you worked long enough and paid Social Security taxes. And finally, we have medical assistance or Medicaid. That is a federal state program designed to provide comprehensive, quality medical care for low-income families with special emphasis on children, pregnant women, the elderly, the disabled, and parents with dependent children. Good job. Now let's go over those last 5 vocabulary terms. Please get your notebooks out. I want you to copy these down for future reference. The first one is insurance. Insurance is a practice or arrangement by which a company or government agency provides a guarantee of compensation for specified loss, damage, illness, or death in return for payment of a premium. And there are many different types of insurance: homeowners insurance, car insurance, medical insurance, life insurance, And what you do is you pay into it so that if something ever happens, you can collect money. For instance, if you are in a car accident, you can get a new car to replace the car that was damaged if you have insurance for that car. The second one is the Affordable Care Act. The Affordable Care Act actually refers to two separate pieces of legislation. The first, the Patient Protection and Affordable Care Act, and the Health Care and Education Reconciliation Act of 2010. Together, they expand Medicare coverage to millions of low-income Americans and make numerous improvements to Medicaid and CHIP, which you learned about yesterday in Lesson 1. Affordable Care Act was the brainchild of President Barack Obama to make sure that every single citizen in the United States has health care. The next term is human resources. Human resources are a set of individuals in a company or business that handles everything related to an employee's needs, such as health insurance, life insurance, short and long-term disability benefits, as well as paid vacation time and personal sick time off. Once you get a job, you are going to have to deal with the Human Resources Department. First by handing in your resume or completing a job application, and then going through the things that I just described in the definition. The next word is Planned Parenthood. You may or may not be familiar with these. They are almost in every single community, and they happen to be America's most trusted provider of reproductive health care, with a focus on education related to individual and independent health, sex, and family planning. Many young ladies like to go there and get birth control. Young men can go there as well. And the last one is HIPAA. HIPPA. It stands for the Federal Health Insurance Portability and Accountability Act of 1996. The primary goal of the law is to make it easier for people to keep health insurance, protect the confidentiality and security of healthcare information, and help the healthcare industry control administrative costs. Basically, everywhere you go now, whether it's to a school or to a doctor's office, you will have to sign a HIPAA form, which is protecting your privacy so no one else has access to your records. Now that we got the vocabulary out of the way, let's go back to what benefits are for me. This is the second part of that list that we saw in Lesson 1. We covered the first three, benefits, Social Security, and Medicaid. And now we'll talk about these last few. The first one is a State Department of Human Services program called ODP, or Office of Developmental Programs. The mission of the Office of Developmental Programs is to support Pennsylvanians with developmental disabilities to achieve greater independence, choice, and opportunity in their lives. The services they provide include home and community services, employment, habilitation. Habilitation means the process of supplying a person with the means to develop maximum independence in activities of daily living through training or treatment. You may have heard the word rehabilitation. That's when someone is injured and they need help getting back to work. Some people need help getting to work, or finding a job, or learning even how to perform a job if you have a severe disability. So that's the difference between rehabilitation and habilitation. And respite. Respite means care after an accident. So if you get hurt and you need someone to come in your home and take care of you, like a home care nurse, to help you get back on your feet, that's respite. They also provide transportation and support. The next one is the County Department of Human Services, which is the Office of Mental Health and Intellectual Disabilities. So this MHID, Mental Health and Intellectual Disabilities, actually falls under the broader Office of Developmental Programs. And they provide short-term inpatient treatment, partial hospitalization, outpatient care, emergency services, specialized rehabilitation training, vocational rehabilitation, residential arrangements, housing, and peer support. In your IEP meetings, hopefully you're attending them, you may have heard of the Office of Vocational Rehabilitation, or OVR as we like to call it. OVR is for youth with a disability who meet eligibility criteria for employment and are interested in working. The criteria is you must have a disability, physical, mental, or emotional, which results in a substantial impediment to employment. Be expected to benefit from services provided, and also be involved in vocational rehabilitation services to prepare to enter, engage, or retain competitive, minimum wage, integrated community setting employment. I want you to pay special attention down here to this IPE. Unlike the entitlement the IEP provides you right now while you are in school, you must meet the criteria to be considered eligible for services, and even then you might be turned down. And that's where this IPE comes in. It replaces your IEP. Services include diagnostic and vocational evaluations, counseling, guidance and placement, training and supports, physical restoration, and assistive technology devices. But you must apply for them. And one of the things about the Office of Vocational Rehabilitation that you should know is that once they enroll you in the program, you will be trained and they will find a job for you, but it only lasts 90 days and then you're on your own. So just be aware if you're thinking about contacting them. The next one is the Children, Youth, and Families, CYF. This is Pennsylvania's child welfare system. It is county administered and state supervised, which means you can go to local offices within your county for services, but the state oversees all of them to make sure that they're running properly and providing the services that they say they deliver. Child welfare and juvenile justice services are organized, managed, and delivered by county children and youth agencies and also county juvenile probation offices. The mission of the Children and Youth Services is to protect children and assure their physical and emotional well-being as provided by law, and to preserve, strengthen, and empower their families. Another resource for you is the Center for Independent Living. It is consumer-controlled, community-based, cross-disabilities, non-residential, meaning you don't stay there, and non-profit. They provide services to people with disabilities as well as families of people with disabilities. Their core services include advocacy, peer support, information and referral, and independent living skills training. More information can be found at the bottom of the resources section on our Moodle page. The next thing I want to talk to you about are two separate programs that are individualized and specific for young folks like you. They're not. One is run by the state, which you'll see here, Pennsylvania Youth Leadership Network. It is run entirely by young people like yourselves who have gone through the system. So they are advocates, if you will, that can really help you on your way. The Pennsylvania Youth Leadership Network is a group of young adults with disabilities who want to make a difference in the lives of youth in Pennsylvania. The mission of the Pennsylvania Youth Leadership Network is to develop the self-determination, empowerment, and leadership of youth that promotes successful post-school outcomes in the areas of education, employment, and independent living, and also health and wellness among youth and young adults throughout Pennsylvania. Notice education, employment, and independent living. These are all things that are talked about in your IEP annually, and you should be involved in those. Hopefully you have been in the last couple of years, and especially this year with Achievement House. But the Pennsylvania Youth Leadership Network will help you beyond your IEP after you graduate from high school. And then finally, I just wanted to put this reminder up here about Job Corps. I recently had the privilege of attending the Job Corps Center in Red Rock, Luzerne County to take a tour, and I actually ran into an old student of mine from a previous school. It was wonderful. Job Corps is a free education and training program that helps young people learn a career, earn a high school diploma or GED, and find and keep a good job. For eligible young people at least 16 years of age that qualify as low income, Job Corps provides the all-around skills needed to succeed in a career and in life. And they really do. The only thing you have to do is sign up and go and work really hard, and they'll do everything else. They provide you with a job when you leave. They pay you for earning your high school diploma or GED. They pay you for graduating when you leave. You leave with $1,000 in hand to start your new life. Certified in a career of your choosing. And you can even go to advanced placement courses in other Job Corps centers across the country. So this is run by the U.S. Department of Labor. It is federally funded, no cost to you. They'll even pay for you to go home on the weekends to visit your family if you have good behavior and are performing well in your classes. So if you find yourself lost after you graduate, give Job Corps a thought. It really, really is a good program, and I'm even more convinced now that I've gone for a visit. If you're thinking about doing it, they offer families to come on Mondays from 10 to 2 to tour the school at Red Rock, and I believe at Keystone as well. So you'd have to call and check that out. Go on the website. So let's review what we've talked about in Lesson 1 and Lesson 2. Our objectives were to identify what benefits are available to you after graduation up to age 21 or upon your 18th birthday. I think we've done that, and we'll find out when you take the quiz. By the end of this Lesson 1 and Lesson 2, you should now be able to identify and compare organizations that are available to you, as well as identify benefits that you qualify for and can apply for now and in the future. And the key word is apply. Our state standards are to evaluate different strategies to obtain consumer goods and services, specifically services in this case, analyze how public, non-public, and for-profit service providers serve your family, and also to compare the availability, costs, and benefits of accessing public, non-public, and for-profit services to assist the family. We also talked about some non-profit services as well. And finally, some things for you to remember. All of these benefits in Lesson 1 and 2 and more are available to you after turning 18 or upon graduation and up to 18, or up to 21, I'm sorry. But you must apply. You are no longer entitled to these services. Now you must apply for them. You must apply for your benefits. I can't say it enough. And if you're 18 now, you might want to start thinking about that. Ask your parents if you have SSI benefits due to you. Watch this lesson as often as you need. Take really good notes. And for more information, print the resources available to you on the Transition Moodle page. And please, please, please share them with your family. Coming up next week, we have no live class due to Keystone exams. However, we will have a SCORM posted for you based on community activities, which include how to obtain your state ID and driver's license, how to register to vote, and then also some community services that are available to you that you might not even be aware of, including how to get to the post office, gym, Parks and Rec, some volunteering opportunities, and we'll be talking more about that in Pod 3, Q4 Pod 3 as well. Good job, everybody. Have a great day.